Okay, you're perfect. You're live. All right.
Hello,
Hello, hello, hello.
hello to the world out there, to the social media spaces that's tuning in, watching us on today. We got another episode of the Hoods podcast, and
And
I
I
tell
tell
you,
y'all,
these
these
shows
shows
be
be coming up
fast.
fast.
I
I
be
be like, dang,
okay, it's another
the
conversation,
conversation.
a good conversation. Ooh,
Ooh, y'all look at
it's,
this candle I got next to me.
God
God
did.
did it.
Yes,
Yes, he did.
yes, he did. Okay, woo, Mr. Brad. I cannot wait. I'm excited, y'all. Y'all just don't know what y'all about to listen to. Okay,
Okay.
yes,
Yes,
we
we
gonna
gonna get
do it.
into it.
So, again, for those who don't know me, my name is Vanna. I am the host and creator of the Hood Talks podcast. We've
We've
been
been doing
doing
this
like this since
since
2020,
2020.
and
And
we are
we
in
are
our fourth season. And we finna get into a conversation. They are not listening to.
listening to us.
Let's talk about birth and Black maternal health. And I didn't want to do a twist because we've had this conversation a lot of times.
I talked to
Doulas, yes, we have. We've talked to community health workers. We've talked to the families. Yes, snap for the community health workers in the building. Yes, yes, yes. That's important work. Okay. We talked to families. We talked about how they've had traumatic birth experiences. We talked a lot about this conversation, but one thing that I wanted to talk to is
is
people who
people
I
I
felt
felt
weren't
weren't
talked
talked
to
to
enough.
enough.
People who
People
can influence some of the change
change
in this,
in this space,
right?
right?
So
So
we gonna get into the conversation, but I'm gonna let
it's
my panelists
templates
introduce
introduce
themselves,
themselves.
and I'm gonna
Let's
start
start
right
right
here
here
with Miss
with
Nigel.
Nigel.
Introduce
Introduce yourself to the
folks,
folks,
please.
please.
Hello.
Hello there.
First and foremost,
I
I
just
just want to express a lot of gratitude towards you because I know that it takes a lot to be able to show up in the way that you do, to be able to create community in the way that you do. So, thank you so much for cultivating this space for this conversation. And I'm looking forward to all the ways that you grow and evolve and expand in this space. I am Najwa Walden. I am a daughter, a sister, a friend, a Black woman, period. And what brings me to this space is in 2016, around the time when there was a lot of media attention around the Black maternal health crisis. I remember experiencing fear for the first time around giving birth. It was something I had aspired towards for the majority of my life. I was always obsessed with pregnancy and breastfeeding as a child. And in 2016, I made the conscious decision to be childless by choice because I felt like there wasn't enough resources or solutions to be able to protect me and to be able to protect my well being. But just like many of us in this room, I also responded to that fear and took a call to action to be able to make sure that I was educating myself and being able to educate as many Black working people as possible, and became a doula. And as a doula, okay, snaps to us, you're able to see a lot of things that aren't being brought to the table and aren't being brought to the conversation. And so a couple of years ago, I made the conscious decision to retire as a doula and to be able to be a part of the community that was actively building solutions that could be disseminated through doulas and essentially just disseminated to Black birthing people to protect our well-being and the well-being of our babies and the well-being of our families across the life course.
Whew.
I'm sorry.
Wow. Did y'all
Y'all
hear
hear she
that I made
made
the
the conscious decision not to be a mother, ripping me of something that I want, but I can't because the choice of maybe having to
leave this
this
world to
world.
bring in a child? So
So
I'm
I'm
going
going to say no
to
to this door
for
for now.
whew,
Whew,
that
that
ain't
ain't
child.
y'all. That hit me. Sorry.
All right.
Right.
We
We
are
are
ready. Okay.
okay.
It's how we starting off. All right. I'm with it. I'm with it. Now I'm not, oh,
That's
Bethany. Come on, Miss Bethany. I don't even, yes, you're going to have to do yourself justice because I don't even know how to, like, this is a gym. Do y'all hear me? Like, when people, you got who? How? What? By God's grace. It was God. It wasn't me, y'all. It was God. So please tell us who you are.
Good afternoon. My name is Bethany, and my purpose is to do the will of Him that sent me and to finish His work. To repair breaches of injustice. This is an injustice, so I'm here. And to inspire, because that's what we need. Excellence, fierceness, and hope. I entered into this space, actually, I want to represent those that have had experiences that did not produce children. Because of being a Black woman running around trying to wear the cape, do the thing, and actually in this building, as a matter of fact, it's Connect Care. People like to forget that, but it was Connect Care. Anyway, I ended up having an ectopic pregnancy. And if the laws that are now in place were in place at the time, I would not perhaps be here nor be well. So I want to represent women who birth systems, movements, nations, people, but they don't have a baby to show for it. That's who I'm here for today.
When we don't talk about those experiences enough, right? The losses. We don't talk about the losses. Shout out to all those who have rainbow babies out here, but who also don't have the. We talk about the struggle of motherhood. And sometimes you can, when you see a mother, you're like, oh, she has a baby, so I know you struggled. But what about the mothers who don't have their babies? They still struggle every day. You will never forget those moments. So shout out to you for that. This is where we are. All right. God did it.
All right. You ready? All right, y'all. I just met this man. Shout out to Kyra. Shout out to my general health crew, Kyra. And shout out to the Centering for Joy, the birthing experience and the panel that you did.
I loved that panel. I love that experience. And so when we came back to the table to talk about guests, we were like, we need the Black men to represent in the space. And Kyra was like, I already know what's up. And you showed up and you continue to show up. And I appreciate you for joining us here at the podcast as well, because you're valuable. I just want to let you know that. So please tell people who you are.
Well, I appreciate it. I'm Brad Edwards. Thank you for allowing me the space on the panel and be here today. So my experience started in, I think, 2019 with stillborns. And through that experience, because we were in separate cities and I wasn't present for any of the doctor's visits or any of that stuff, like I realized in that moment how defenseless I was, not only for myself, but like how I couldn't really add any value to her for these kids because I wasn't part of the experience from the beginning to the birthing process. So fast forward in preparation for my daughter, who was born in 2020, May of 2020. Started working with some people I went to Fisk University with on a digital platform called Cure. It didn't come to fruition, but the first thing we were working on was Black maternal health because of people like Kyra. They've helped me understand more than my own personal experience, what they were like for other people. I was able to interview all these different moms that had all these different crazy stories, and hearing their stories made me understand how important education is for men to know these things, and also for other Black women to have these conversations. Like, not to be in Black women's business, but like when me and Kyra did a virtual introduction to doulas, I didn't realize how many Black women didn't know about doulas and what that was. Even with my partner at the time, I was suggesting a doula, and she was like, I don't want a doula. Like, why I need that? And then when it came to the day of the birth, she was like, hey, the doula you was talking about, can you text her? So now I ended up a three-way conversation so we can have these, talks. And then for our second child, we had the doula, night nurse, and all these other resources, because then she understood like what that looked like, what that needed to be. So I'm community organizer for Dear Fathers. We are a media-based platform that tells the stories of Black fatherhood. And mental health has been a big component of what we do and what we've been successful at since 2020. But now it's time for us to make a shift to make sure that maternal health and those stories, we have a dash with delivery. This is one of our story platforms. So that gives our dads all over the world opportunity to tell their story of what that experience was for them in delivery. And through that, guys are able to see, okay, I do need to be more present, or these are the things that can happen. Because if we're not having these conversations amongst men, then we have no idea what's going on. So I think that's, just the conversation is something that we want to bring to light over here for our listeners. So again, thank you. Looking forward to this.
Shout out
to him.
Shout out
to that.
I
agree.
We
don't have these conversations enough, and we don't. Men are not necessarily always included. And I think that's important because when we talk about Black maternal health, I think it's important to also know that this is not just Black women. Right. This is not just Black women. I know that Black women is the center, but that's not just what it affects. It affects father, it affects child, it affects all of that. So in the title, we say they are not listening to us. Right? We know who we're talking about when we say that. And if you don't, I'm going to say it for you. Black people, Black women,
even Black men, Black families, Black children. I've even heard some people saying their experience of taking their children to the doctor. Their children tried to speak up, and the doctors kind of denounced them. So I just want that to be clear when we're saying who when we say that. But I also want to bring a question to the panel to ask, when you hear they are not listening to us, what are the stories that you're hearing? What are the common challenges that comes up in these spaces when you hear stories or your own experiences? Free, please, free for all. Thank you.
I'm an extrovert, so I have to count to 3 and then talk. So when I hear that question, the word that comes to me is invisibilized. People who have been made to feel as if they should not exist, don't exist, that their voices, that the color, the expressions of who we collectively are don't matter. And when systems and structures are designed with intent to make you feel that way and reinforce that you should be invisible, over time you're conditioned to respond in that way. And so a lot of the work that I remember in partnership with Generate Health and leading IHN at the time was really about listening to Black women who said at that moment, transportation systems, the ways to get to and from, both in the public space and in the places where the services are paid for through health plans, do not listen to us. When I pick up a phone with my voice sounding Black, they listen to my voice sounding Black and don't trust my voice, and it takes my white physician to pick up the phone after me to get to my appointment that is paid for through my plan. And then turn around and say that the community doesn't actually know that these services exist so that they can keep the money in their coffers and never spend them. But they do build beautiful buildings in Clayton on those dollars. So when I think about invisibilized, that's what comes to my mind.
And don't put it back on community.
Oh, well, the community should, and the community should, and the community. What do you, as the person who's serving the community, supposed to do? So I'm glad that you said that. I set up my two is that. Oh, well, the community, we want to empower the community too. No, how do you make it easy for the community too? How do we change that language? I'm sorry, I had to get into that because I just, we love to put it back on community, but come on, Nigel, come in.
There's so much that came to my mind. I feel like there was just a flood of experiences and a flood of emotions, which is honestly unfortunate that, when asked to incite traumatic events, that there's a flood of trauma that comes to mind. And so to be real specific, because we could talk about this all year, all life long, But I think about the feeling that a lot of Black women have as if we are being asked to wait for something to go wrong. I think about a lot of the women that I have shared a community with who have had ovarian cysts or who have had fibroids and have had conditions where either physically or intuitively we know that something is wrong and that something needs to be done, whether it be for our own personal well-being or for future reproductive health, and then being asked to wait and see what's going to happen. And I don't think clinicians really understand what it feels like to feel like you're waiting for death to happen to you, because that is essentially what it feels like. And to be in those conversations in that type of situation and to advocate for yourself requires even more stress and even more vulnerability, because now I'm having to repeat myself. Now I'm having to raise my voice. I'm being conscious about not being too aggressive, but assertive enough, and knowing what to say. And it can just be really overwhelming to feel like, as a patient, I have to teach you how to treat me. I have to teach you how to approach me and my experiences with humanity, and with humility. And I feel like, honestly, I also recognize that that's how it's always been for us, that this isn't a 21st century dilemma. If we think about the origins of obstetrics, it began with silencing Black women. And so I think it's really important, because of course I always like to have some type of optimistic ending to it.
We got to, right?
We can't just talk about the things that are wrong, but the quote that comes to mind is like, the master's tools will never dismantle the master's house. And I do understand that in many situations I'm in environments where I'm expected to be silenced. And I think it just requires even more so that I resist against that. And how it is radical and how it is a form of self-care for me to speak up for myself. It's not a burden. It's not something that makes me, a non-adherent patient. But it's something that's gonna save my life. Because if you won't, then who?
What you said.
Did y'all
Come on now. You have to speak, and I
think you're right.
I think it's been
Instilled in us to be silent and just to take what we're giving, right? Internalize it, and also just, this is good enough for you, right? Be grateful, be humble. I know these are things that we say often, and I'm learning to say those things in a sense of like, because do you really know what humbleness means? But who taught you to do that? Who told you had to? But showing up to be silent because you feel like you can't, say, but I don't think that's right. How dare you? When you get that back, right? How dare you say you? How do you know? Did you go to all the education that I went to? Did you go to the school? Did you read and study? But I know me. I know my body. I do, and you do. The folks who are watching, everyone knows their body. Speak up; it will save your life, and not just in maternal health. And I just gotta say this because it's telling me to say this. I think we need to speak up on in all spaces. Look where our world is going, because we're sitting silent. They spoke up. They speak loud and clear every day. We need to speak up. So I'm just have to say that. Not just when you're birthing, but in everything. Black people, your voices matter. Speak up. So sorry, y'all. No one else has anything to say to that. I'm gonna move ahead, Mr. Bright.
So I'll speak. So my first experience, that like outside of losing the twins, we did go to one appointment. Or I did go to one appointment prior to that happening. And because she was a pharmacy student, she didn't have private insurance. She was using state insurance, and we were at St. Mary's. And I remember going into that room, and it looked like how farmers have like all these cattle like just kind of pouring into an area. And I was like, this is crazy. So then when we got back to the room and like she started to be seen by the provider, it was very short. It wasn't anything with any type of care. And I was like, damn, okay, this is kind of wild. So everything during that experience it was terrible. So then the next pregnancy, with the putting private insurance and all that stuff, it was a different level of care. It was still kind of dismissive on certain things. Like, even though this lady's a doctor and it's like, I still don't care because I felt like because you're a black woman, that doesn't matter to me because I feel like I know. So that's my personal experience. And then with her being a pharmacist in the 6138 area code, it was a lot of young women that were coming in that may have not had the highest levels of education. So they're being prescribed medications from these providers that were harmful to their child. So when she would call and tell the doctor, hey, why did you prescribe her this? Because this is going to make her abort the baby or this is going to Z. There was pushback like, well, how dare you tell me this? And there was several times where she would have to go to battle for these patients. But if she's not the provider, she's there, is for them at that particular time, no one else is going to be an advocate to tell this young lady, like, this is going to be something that's going to be harmful for you and your child. So that wasn't my experience, but like hearing these stories is still like the things that make me want to be more of an advocate.
And then we wonder why we have distrust, right? That's about the distrust. We talk about why women are, Black people don't want to go to the doctors. Because I might not know
what you're providing or giving.
Like take medication. We don't even take the medication. You can prescribe us the stuff all day, but we are not taking
the medication, especially if we don't know what it is doing for us or to us. And then you don't want to take out the time to even explain it. But to me, I'm hearing too, you don't even care because you're sounds like purpose giving it to me, right? But that's a whole nother conversation too.
They are not
listening to us. They're not caring for us. The dismissiveness.
Oh my God!
I don't think people understand the trauma. I'm gonna put myself out here. I don't even like going to doctors because it ain't just one hospital that I've had experiences. It's been, I can count all of the St. Louis hospitals. Recently, one time I tried I'm like, I'm just try another one. That's an experience off my list too. So I just want to say that to emphasize that this is not one hospital. This is a culture. This is a system. This is what we're talking about. This is why folks don't. That's why we're here, right? That's why we're here. But what do we do to change these things? Because I heard you say too, we talk about the problems. What are some of the solutions that you can think of that can change the impact? So people can feel safer going to the hospital, going to the doctor. Like women can show up and feel heard. What are some of the solutions to get us to that space?
I got four, and I'll do them fast. I think number one, it's about purpose. So each one of us has to get really clear about our why, and instead of showing up in places, spaces like question marks, people gonna treat you like how you show up. You show up like an exclamation point because that's how God created us. So the first P is purpose. The second one is position. I am very clear that I'm extremely angry all the time about all the things. And I'm supposed to preach God's love at the same time. And you can do both. And so the passion is the anger and the love that's mixed together. Leveraging that as a fuel and not a venom for us first is important. Because a lot of our act out, we get nowhere because the pain leads and then the message gets shut down. So I think about positioning. I spent a lot of my career protecting systems. I'm spending the rest of my career protecting people. So you have to be clear in yourself about where your spot is and then show up in your spot. Third is about persistence. The other side of this battle, they tee up for generations. They tee up for at least 7 generations. We've seen what's happened on the national stage. When we were celebrating in the 60s for what we thought we had in perpetuity, they were fighting in the 60s for this moment on the Supreme Court and other places, and they never stopped coming. We celebrate one win with one Black president, and then we move on. How is that possible? So what we really need is persistence. We need pipeline. I'm not okay if my nieces or my next generation are not in this room seeing me in this mic and thinking about the next way that when I'm gone, I'm picking up this mantle. If I collect the racks and racks and racks and rows of awards and my name is in lights and there's no one coming after me, I have failed. So to think about persistence and how we're handing off and how we're building pipeline with one another. And the other piece is important, we need policy. We need sufficient ways with which to articulate what we want and how we want. Not only do we need to hold others accountable, we need to become the accountable bodies that are in positions of leadership that can move power, that can move change, that can fund it, that can get in the way to get out of the way. The other P is to protect progress, because Black people are making progress. Why do you think everybody's so mad? Because we are winning. So our position is not that we are in reverse. It is not that we are scared. It is not that, oh my God, whoever can get into the office. We are so powerful. And did you know we're the people of the global majority? We are not the minority. Get that out your language. We are the people of the global majority, and we need to act like it. So it's about a mindset that has to shift. And in that mindset, in that policy, in that purpose, persistence, and in position, and staying in position with our own wellness first. Because if we lose you, we lose, right? And we are so willing, Black men, I hear this a lot, I hope we talk about this. I hear Black men say so much, if I have to die for, if I have to be sacrificed for. I think we have collectively as a people done enough sacrificing. And for the Christians, Jesus died on the cross once, he did it for us all, right? So we don't need no more death. We need to think about what is vitality and what is life and what is abundance would look like in practice, and live that thing out and inspire people to hope for something better than to fight against something negative. I'm just sick of fighting against. I'm ready to fight for. So I'm just over it. I want to spend time investing in ways with which we dream dreams and we make dreams happen. And then you let people choose between what was these old systems, these antiquated things that don't work, or you get on board with other things like community health worker movements who are the trust, who are the life, who are the translators of what needs to be. You fuel and you fund that. That's what I'm sitting here for. And then you start letting people choose between what was and what is. And we are so powerful, we always choose right. So we have to trust our instincts. Okay, I'm starting to preach something.
I love that. And to follow up with choice, I'm going to piggyback off of that for sure, because agency is important. I would love us to have more communal approaches to maternal health and well-being. I am not sure why, as a Black birthing person, I am expected to be solely responsible for my health and my well-being while carrying an infant, while caring for an infant. I want to be able to visit my clinician and feel like I can call my mama to tell you what you need to do, because she also understands. She also has the ability to advocate. And I feel like that's lacking in our community. And it hasn't always been that way. I think about it, I'm in food. So I think about it in terms of, providing an example. There's a lot of us where somebody asked you, how do you make macaroni and cheese? Regardless of being in your household, we would be able to make it in the exact same way. Same thing could be done with fried chicken, with macaroni and cheese. And I feel like using that in context, those types of practices and those types of resources for pregnancy and for maternal health, they also need to be shared. I don't think it's enough that there is one person or a set of people that have really healthy outcomes if other people don't know how to find their way to the outcome as well. And in addition to that, I feel like, we got a little sermon going on
over here.
here. In terms of providing people with agency and choice, I think we need to think about maternal health outside of those 40 weeks, outside of that first trimester, second trimester, third trimester period, because my reproductive health and my well-being starts the minute I start menarche. And if we were able to be a lot more attentive to those of us who have PCOS and endometriosis and painful, periods and period disorders, then quite perhaps our preconception health would be a lot better. And so our pregnancies would be a lot better. And then our postpartum would be a lot better as well. And it just doesn't stop with postpartum as well. Menopause is a part of maternal health. Menopause is a part of reproductive well-being. And if you think about reproductive justice at its origin, is about providing people with the choice to be able to have children. So regardless of if we actually do conceive and birth a baby, it's important that our bodies still hold that ability to do so. And I think that there just needs to be a lot more focus and a lot more care on the physical body outside of it being pregnant, outside of this being someone who's had a child. But I think we just need to make sure in general that Black women are well, regardless of our decision to have children or not.
Period.
Making sure that Black women are well, period. Ooh, because it goes back to what you said about the Cape, right? Black women have been what we call the center of caring for everyone. And so it's usually hard to take off the Cape and care for my wellness. So I struggle with that. So I ain't gonna sit here and preach to y'all because I can't. I'm still trying to get my life together.
I'm working
on it.
We all, but I
agree with you.
And I
also think there's a period beyond postpartum when we talk about shout out to the moms group in the building. When we talk about parenting, period. Yes, mental health after your children are, postpartum, pregnant, postpartum, you have your baby that first year or so, 3 or whatever. I'm coming up on 4, and I still got to check my mental. I have a 6-year-old and a almost 4-year-old. It's still like, Savannah, are you okay? Because that affects who? I saw something on Instagram, y'all, real quick, and it said, now shout out to my brothers.
Don't take this personal. I love y'all. But it did say that the effects of a child is not necessarily relying on the father being in the space. It's relying on how the mother mental health is. And I said that is so true. Like we're not saying that the father needs to be absent, but we're saying no matter if you're there and the mother is not good, who's usually taking on the position of caring for the child, that can affect child. So I think that's important. We don't talk about that enough. Period. We see people pop off at their kids in the stores. We like, what's wrong? What's wrong? Come on, community, right? You got all the judgment to say, right? You see a mama like, what you doing? You want? Why is she talking? Because have you thought about what's going on with the mother? That's my first thought. I'm like, can I help you? You need some help. Because I understand. I'm dealing with work. I'm dealing with life. And I might be doing this alone. And then I don't have a village. And then I have to care for a child all day. All day. Come on, y'all. Don't be quiet. All day. Come on.
And all night.
And all night. Because some of them don't want to go to sleep. Okay. 12 o'clock. I'm like, can we go to bed, please? All night, and I got to wake up and do this all over again. And you telling me it's self-care? Who funding that? Don't let me. And you talking about you preaching? Who's funding self-care? Who? No, y'all laughing. I'm trying to get my resources. Who is telling me I can go to the gym and you gonna care for this child while I do that? I was told I couldn't even go to the doctor during the pandemic with a baby. I couldn't bring my baby to the doctor with me. So who gonna raise my baby? How am I going to care for me if you're not supporting me to support this child? How do I show? Y'all got any solutions? Ask. It's real, right? This is real life. I even have a partner, and I be like, we need a break. Do you hear me? I don't just be like, we need a break. Who's funding that? You talk about philanthropy and money moving. Who is funding the self-care, the wellness? Where is that coming in at? How can we make that happen? That's my question to the panel. Then I'm coming to the audience questions. How do we start that process?
Well, I'm a self-care girly. I love self-care all the way down. And again, I feel like it should be communal. Like as I'm hearing you speak, I'm like, okay, who is coming to help Savannah go out with her man? Who is going to watch the children? Who is going to bring you food? Who is going to take you with them?
It's cooking. I'm tired of cooking.
I mean, I feel like it's so simple, but it adds up, especially when you think about maternal mental health. I talk to so many moms who just say, if I could just get a couple of hours of sleep, if I could just get a good meal, like I'm so tired of eating fast food, I'm so tired of heating things up. If someone could just rub my back, if I can just get my feet rubbed. And so I think it can really just be that simple. You know, it doesn't have to be a $500 spa day. It doesn't have to be getting food out the country, although you should do that for Savannah as well.
Come on, fly me out, y'all. What's up? I got a man now. You got to pay for his ticket too.
I feel like it really could be that
simple. I feel like for me, especially as a doula, self-care has looked like if I have extra food that I've meal prepped, I'm bringing it to some mamas. If I have some time on a Friday night and I'm not going out, do you need to? Because I will watch your children. I think it can really be as simple as that, but it really does take a village to do self-care.
Is it okay if I add to that? You asked about the house. I want to call back to our remembrance one particular method because I know that in many spaces, not all, the church is seen as the harm or the harm done. But there are some spiritual practices that are very effective for self-care. Now, I'm a person of the Pentecostal persuasion. And what that means is there's alignment with the way that African people get down when we express ourselves. So practices like when our bodies shake, when our bodies cry, when we feel compelled to open up our mouth and holler, when we have to get on the altar and do an exchange of what we had and what we need. Those are practices that unfortunately I think sometimes we have been told that the white man did X, Y, and Z, and we step back from the things that actually we knew were good for us before we had the data, before we had the science, before we had the evidence. So there are places and spaces that I think need reclamation. One of them is the Black church. I know because I'm leading one, not all, which is good. But there are places where you can find space with which to worship, cry, praise, sing, exclaim, art, paint, dance, move, poet, whatever it takes, right, in those realms. I would say it's not going to be popular. We do have to be careful about how we self-medicate. Some of the things that may be popular may open up your spirits to additional trauma. Right? Everything that some people can do, you can't. Your mom used to tell you that, right? So be really careful about the things we put in our body and the why that we do them. Start asking yourself the question before you pick up a whatever. I don't care what it is, aspirin, coffee, or stronger. Why am I doing this? Because I think that spirit is trying to get us to a point where we can handle the truth about the things that he or she or they are trying to uncover. I think we're doing a lot of avoidance as the Black community about what the root cause of our pain is. And instead of leaning into things that just actually create more depth in the trauma, why don't we find ways in community to reach out and just say, hey, honestly, this is what's going on. It's something really liberating and opening up our mouths and confessing the truth. And I think we need to start there. Here's my fivefold real quick, and then I'll turn it over to my brother. We start with honesty. You can't really sit in the truth if you're not honest with yourself. And it takes courage to be honest. And a lot of our issues, I think, is because we're self-medicating to not be honest about the pain. From honesty, then we sit in truth. And from truth, we really don't get to reconciliation. Respect South Africa. But from truth, we go to reckoning. We need to sit in the space of reckoning and call leadership into accountability to sit in reckoning with us. That's the grapple that we need, naturally and spiritually. And then from reckoning comes the reconciliation. And then in reconciliation, you get shalom, peace, well-being, all those things. So I think that method, that practice of slow down and really sit in, why am I doing what I'm doing? Why am I eating what I'm eating? What is it that is driving me? Because I'm tired of being driven by something that I'm not empowered by. That's the root cause question that I'm asking us to really center for health and well-being.
Well, I don't want to bother anyone. So I can't really, obviously, I'm not a mom, so I can't speak to that part. But I am a co-parent, and I'm a co-parent and co-parents long distance. So she's in Chicago with my 2 children. So if there's any time, we're in a space right now where we can communicate well. So if there's times where, like, hey, I got a lot going on between this, that, and the third. Okay, cool. Let's move up the schedule time. We need to get kids. I'll come get them tomorrow or the next day. My partner does whatever work with me on that to make sure that we can make accommodations to get the kids to get first space. Because I do understand that because she has them a little bit more majority of the time, I do that. There is a lot of pressure to come with that. She's doing a lot of things, so I never have a problem doing that. What I can speak to is the men's side of this when it comes to mental health. So the days where I have my kids like 6 or 7 days and I go drop them off, those first 2 to 3 days are very, very difficult for me. Because I've gotten to that routine with them, and my routine when I have them is tight. I tend to spiral sometimes after I take them back, and that takes me completely out of my routine. When I talk to my other guys that either co-parent in the same state or co-parent in different states, we all going through the same thing. So like I talk to my kids every morning, they're gonna call me between 8 o'clock, 8:15 on the way to daycare. And like, what's today? Saturday? Just Wednesday when they called me, like hearing their excitement and hearing them talk when they heard my voice, like I had to put my phone on because I literally cried. Because I can't be there with them, and like my only form of communication with them right now is FaceTime. Like I FaceTime today before we started the panel, or those phone calls in the morning. So those phone calls get me through that day. It's tough because I know I can't see them. So you know, it happens on both sides. We were talking about women and that thing, but I don't want it to be lost that a lot of men go through the same thing. Like we are hurt when I see our kids, we don't have them, and having that space and distance. So that's what
I think that was so valuable to say because I agree. We don't hear that enough. So we definitely not taken away from. And that's why I'm glad you're here because I think that's not heard enough. Right. It's even if I'm not in the space, that doesn't mean that I don't love my kids just as much as you do, Mama. You might have them more, but I do care. And every situation is definitely different. But that's what I also said. Like I'm in the house with he has them now. Shout out to him. But I can also be like, I think you need some time, right? I need you to go and do something. Or figure it out. Because what you said, if you had them in a routine that you might have when they're there. Can you?
I don't know, mamas parents, right? That routine that goes all day, and then she's far away, so you can't be like, hey, tap in real quick, because you got by yourself, and then you have this routine that you've already done by yourself. There's days I get one day by myself, I feel different. One day, I even have to get up and make anyone breakfast. Do you hear me? I don't even have to make no food. Ain't nobody saying I'm hungry. I could just lay in this bed and not do anything. Right? I don't care if I'm hungry, because I can ignore it. I can ignore that if I'm hungry, but they don't let you get hungry. So I'm just saying it's a different. And I also want to acknowledge that we don't put enough emphasis on Black men and Black men being in the space of fatherhood. We don't. And that is a whole unit that needs to operate so that Black maternal health can also be impacted. But that's why I said it's beyond just Black women, right? That whole unit has to operate so that child can move and grow. And so we can all be well. So I just want to, I appreciate you, Brad. I do. So I'm opening up. Who got a question, comment, the audience? What you got a thought? Please share. Feel free. You want to uplift something? You want to ask the panelists something? This is your time to shine. I saw you move. Come on. Yep. Mm-hmm. I saw you.
My inner thoughts. Can I just add this? When they turn,
Everybody in my household, when they turn 6,
they have to learn how to make eggs different ways. And that way you don't have to do breakfast, but just bring them to my kids. And a little it makes sandwiches and cereal. And if we talk about that, we talk about including, like, just making sure that everybody's involved with supporting. Excuse me, I have a mint in my mouth. But even with the kids, I have conversations about, well, you can make a sandwich, or you can bring mom, some cereal, or bring her something that's easy, or bring the diaper to the, bring diaper to mom. Even you got a 2-year-old, what they want to do? They want to help you. They want to, they want to feel like they're a part, or they're doing something to contribute. And so just even like, and I have a rule, like, if you're sitting down and you're nursing your baby, make sure that toddler is sitting there and you're reading a book to them, or you're doing something because you want them to be included. But I will say, when we're talking about fathers and making sure that they're included in the space, my experience coming in years ago as a breastfeeding peer counselor and bringing the fathers into that space was so interesting, because often they would come into the WIC department and they would sit out in the waiting area, because no one ever invited them to come in, to be a part of the process. So then I would peek my head out like, okay, and we're gonna talk about breastfeeding. But it was so interesting to see how they really engaged with the mom. And anyone who's a birth worker in here and does like doula work, we get an opportunity to see them like at ground zero, when that family is forming and it's starting, and giving them a space, giving men a space where they can feel comfortable to say, you know what, I know that you may not have been given an example of how to show up for her, but hey, these are ways to show love languages, right? These are ways to show up, for your partner. These are ways to show up for your children, and then leaning on the men who are in the space to kind of come in and be kind of like that mentor and kind of show them example. I feel like they do so much better, and we have an opportunity to bring back that village mentality, because that's really what we've lost. We just really lost the village mentality of just really supporting our families. So when we're having these conversations about, well, they're not listening to us, it's like they're not going to listen. Like we just have to say to ourselves, they're not going to listen. Now that we know that, we're aware of that, what are the next steps? What do we do? Because it's like when you don't know something, okay, you're like, okay, well, I didn't know that, and we're going a different way, and we found out that wasn't working. But then once we know how things are going, it is our responsibility. We have to take some accountability for where we say, okay, they did this. Where we are now, what do we do to be part of the solution? And so if we're not including the family, if we're not changing some of these ideals and some of our culture to support our families in general, and stop just thinking about, well, just women, just pregnant women, but just our families in general, we have to realize that we are a part of that solution, that we get to come in, like you said, we get to come in and I can take your baby, or I can bring you something to eat. we all have to be thinking about that collectively so that we can support these very ones that are very vulnerable and they don't have any type of sense of support.
I'm gonna add on to that, and two, then we need to invest in those too. We need to invest into that system, right? I just want to say that in the sense of when we talk about showing up, it's also take time to show up, right? And if I'm also, we just had this conversation with Nigel. If I am not overflowing, if I can barely make one for myself, how do I help my neighbor? So how do we make sure that everyone has what they need to thrive so that it pours back into the community and that healthy village can show up? Because if I'm depleted, I'm not showing up healthy and whole. And that's what we have a lot of. I want to show up, but I'm showing up over here. I'm trying to show up over here. It goes back to what you said about self-care and your own wellness. So then I'm depleted. And then I'm not, you wonder why I'm not showing up. So I just want to emphasize that. Go ahead, right?
It's like even to the to her point about breastfeeding. I think you give most men an opportunity to understand what that experience looks like for the mother, what that stress level looks like for her. Like we're going to be there advocate, right? So she had both kids. She had postpartum preeclampsia, right? So breast blood pressure super high, medication, all that. So breastfeeding wasn't really an option when she was trying, she wasn't producing. So if I'm not aware of these conversations and understand how her feelings are going, I could be oblivious to it, and then for her to look like I don't care. But because I know that like you're not producing, or you're not able to do X, Y, and Z, I understand that you're going through all these things mentally. I could be there for you. I can provide you a level of grace that you're not providing yourself, and I can help you through this. But if no one is expressing to men that this is a way that women feel that this is even a thing, because I wouldn't have known that a woman not being able to produce for a child is like making her feel like she's not really, you know what I'm saying, the level of mother that she wants to be and all that. But because I know that, I can share that with my brothers and we can have these conversations so that they can have an understanding of what that looks like. I didn't know what postpartum was, postpartum depression was, until I created a group chat with some other dads, and they help me understand, like, all right, this is what this may look like for you. So it's not about you. Take yourself out the equation, understand that her hormones are going all these different places, and she's trying to figure this out. So make sure you give her, this level of grace, whatever. So if we're not if it's not communicated to us in some way, in order for us to communicate it with one another, then it's gonna look like we're not showing up. It's gonna look like we don't care when we're just not giving opportunity to care.
I think that was interesting to say, and I agree. If you don't know, how would you know? If you don't know what you don't know, how would you know? And I think that goes to one of the things that I think that a lot of men and women need to get in some rooms and have some conversations. Somebody breathe heavy. They felt it. A lot of men and women need to get in the rooms and have real conversations.
Hi, everybody. My question really is to the panel about this word called vitality. For a long time, we've been in this space talking about mortality and what that looks like, death, dying, and despair, and we've swam in it. We don't need anybody to tell us what that looks like, but can you all talk about what vitality means to you?
I think that is an amazing question. And I'm so glad you raised it because my mind was already going to that place already. Especially because when we talk about partners, I think a lot of times we think about partners as allies, we think about partners as advocates, but we don't often have conversations about partners and pleasure at the same time, which I feel like is important because Black birthing is joyful, and it is clearly pleasureful, considering how these babies got here in the first place. And I think that it's important to be able to romanticize more outcomes and romanticize birth. I think a lot of times, after birthing people deliver, we look at them and we look at us as mothers. And although I may be a mother, I'm not your mama, so you can still touch me, okay, but you did for this baby to come in the first place. And I think about Candace, in her, lactation and breastfeeding work, and we know that oxytocin is important. And, in addition to oxytocin coming from that connection that you have with your baby, it also comes from that connection that you have with your man. And it's really important that when we think about maternal health and vitality, that we also just think about well-being in relationships. And we consider, what does romance look like when there's a baby on board? What does joy look like? What does pleasure look like? I feel like if we thought more about what we wanted and how we wanted to feel good, then maybe our imagination of those outcomes would also reflect what that looks like to feel and to be good.
Yeah, I be seeing them birds. The men be over there rubbing on girl. Be like, yeah, get her together. You better. Y'all know them work videos? Like, hey, let's go help. Hey, twerk that baby out. Twerk that baby out. This is the podcast. I'm sorry.
I think vitality is multi-generational. I believe that it means truly the village, where the aunties come in, because I'm one of them. Aunties are like the respite, and they finance the dream when the others can't, because they money really is the village money. And aunties love that. We like being part of the mix. We like when we are not discounted because we haven't had the uterus full experience. Oh, you don't know what that. You don't understand. Well, actually, we kind of do. It just looks different and feels different. So the inclusion of all within that multi-generational village, remembering what grandma and like they didn't just pass down trauma. The elders did the best they could with what they did not ever have, and nobody told them either. So I really love reinforcing, providing a level of grace I can't provide for myself. Like if we all had that rule, thank you, brother. That really goes a long way, and I feel like that statement looks like love, right? I think it looks like love. I would also say that there are other support systems. No one talked to me about perimenopausal nothing. Till all of a sudden the flashes of the thing. Look at all the head nods in this room. Nobody talked about it. All of a sudden it's an experience for you with all this happening. And so again, the ability to sit in a village and go, like, what in the world is happening right now, right? And it's not the cranky, it's not the funky acting, it's not that, brothers and family. It is something biological that you don't even understand how to articulate. And it's not pregnancy, it's a whole other realm. So I'm just re-emphasizing vitality looks like a space for every single person to be part of who helps, part of who pitches in. Even those that are like neurodivergent, those are the creative uncles and aunties and family members, right? The kids like them the best. They're the most fun. They're the most safe with your children, for real, right? So like how we get together to figure out how we allow for more, right? I think sometimes we get protective. I understand why. But in that, I think including a couple more people that you may not have considered that would love to be called in. Because we are experiencing so much isolation. People are pent up wanting to love somebody. So tap into that.
For me, so at Dear Fathers, we have 4 pillars: mental health, physical health, financial, and literacy. So those are 4 things that we focus on monthly. And not every man, most men don't feel comfortable when they're not doing all 4 of those things in some capacity. If a man is not making enough money, he feels less than. He's not in shape, then he's not, able to be as energetic and give it to his village, his family, kids. You have to be educated, you have to be well read. And you got to take care of your mental health. You can't pull from empty well. And that's one thing that we always emphasize. So for us, in looking at us being the leaders of our villages, our families, our households, if we're not taking care of those things, then we can't be the person that we need to be for everyone else that's around us. Community is a huge thing for us. So being able to share in those things, those topics, conversations, in a communal sense, that's everything for us. That's how we continue to grow and build our communities and our networks to be as strong as they can be, so that we all can be stronger, we all can grow, we all can be, vitality. And that's it.
And you know what that also makes me think of? I think vitality also looks like healing from things that our children won't have to. That's really important for me. As someone who's considered high risk for a variety of things, from fibroids to breast cancer, because of the experiences of my mother and her mother and her mother, I have to often be honest with the fact that these aren't genetic, predispositions that I have. These are lifestyle predispositions that I have. And a lot of my well-being has encompassed having honest conversations with my mother and having honest conversations with my grandmother and asking them, like, what are the ways that you felt like you should have really dealt with your stress? If you were able to take care of yourself the way that you really deserve to be treated, the way you wanted to be treated, what would that have looked like? And for us to be able to share that information with our daughters, we have conversations now about having conversations with our partners and, with our clinicians, but I think it's also important to have those conversations with our children very early, so that they don't have to learn later how to care for themselves. That is something that they're taught to do in the same way that we have to learn how to do chores and learn how to take care of our basic needs. I think it's also important for children to learn and for us to be the teachers of what health and what well-being looks like.
That marked. Ready? Okay, let's go.
I have two questions, is that okay? I'm gonna talk to you first, Brad, so you don't have to go after them. In working in maternal health, I've learned that as women, our bodies will expel anything that's not viable. Okay, and so for mental health and physical health with dear fathers, I've also learned that when men binge drink, they're increasing the risk to 55% for congenital heart defects in unborn children, along with tobacco, lack of proper diet, lack of rest, that fragments the sperm. And so in doing so, that's increased women's risk of miscarriage up to 50%. So maternal health can't just be about mom's well-being. If her external environment is toxic and not bringing that vitality that she needs, it's a pressure. If going into the hospital is also a pressure because of the wrong therapeutic interventions. And then now on the flip side, I'm dealing with sperm that's not up to par. How is your platform impacting the brothers that you talk to in regards to their mental health and their physical well-being?
That's deep. I never considered the sperm part, so thank you for sharing that. Because that's something we'll definitely take back to the platform. So with our mental health, we have it's called Straight Mental. We started in May of 2020. Actually, the first session, I hosted every month. The first session I hosted right before I left to go to the hospital to have my daughter. So we've served over 6,500 guys from all over the country. And we have 2 clinical therapists come on to each session. My goal initially, because the topic of mental health was starting to become more of a common conversation, I wanted to introduce me into what their therapy history looks like and what therapy can really look like. So what we were seeing when guys were commenting, like, I thought that this would be like going to the actual doctor, right? Like I thought someone that doesn't understand me, that's going to be this real clinical kind of experience. And what we saw was 75% of the guys that were coming to our group sessions were then contacting us or going out and getting their own therapists. So we have guys that have been part of our sessions literally since day one, and we're just having these open dialogues and conversations about mental health, about substance abuse, about, we have guys that have had strokes that are in our sessions, and now we're talking about, hey, how can we improve our physical health? We have trainers that come on to our IG lives and talk to guys. So our platform is 300,000 on Instagram. So like we have a wide range of people that we deal with and people that come on and have these conversations. When we deal with NBA teams and have these pregame panels, we have all these people show up and they show up with their families and we have these conversations. So our biggest thing, like I said, we're a storytelling platform. So our biggest thing is using our shared experiences and telling these stories with other brothers so they can learn from our mistakes, or we're going through something together. Now we can push the accountability partners for one another.
I would like to offer at a structural level, hospital systems whine and complain about the fact that there's not enough of us that reflect the population served. That's actually not true. So the recruitment, there's something about the recruiters. They're typically white. They're typically suited. Clearly, this is an important point because I've got fought saying it before I even inhaled. I'm gonna say it anyway. So because of that, the recruitment strategy is really intent on prioritizing and favoring white women in the field of healthcare. And white women, I try my best to love you, but for real, in this structural space, something about how white women are rooted to not hear us, to not value us, and to undermine our pain when we need you the most to be allies. Literally, I wouldn't have my 2.5-year-old niece because people don't listen and they don't respect. So what I'm saying is, I think the hospital systems need to do a better job of hiring us in places and positions of power and influence, number one. Number two, if you look at the data, and I want you to go back and look at the data, a lot of people who are recruited in these high need positions when we are in crisis, they drive 45 to 50 miles out to get these VIP jobs in the emergency departments and other places, and they overlook us. Black nurses are out there. Black everything is out there, but there's something structural to the recruitment process. And once your bestie white girl gets into some of these positions, she recruits her friends. I'm telling you what I know. And I don't work for them no more, so I ain't got to. So you need to follow the data. You need to follow the information. You need to pick up phones and ask why structurally, when this town is as brown and beautiful as it is, why our healthcare systems don't reflect that. And why one kind of population of chick keeps being in the delivery rooms, and that's why we're dying. That's the question that's on the table.
Okay,
I'm gonna take one question.
I'm gonna come
Come
back.
back to you later, though.
I got one question from you.
So it's twofold. I just want to be honest about it. I'm gonna make it quick. So I'm gonna put myself out there. I am someone who has struggled since I started administration with fibroids. I later found out that I had PCOS and endometriosis, and ultimately had a hysterectomy at the age of 40 without having children at all. And so in those spaces, I had a numerous amount of tests done. Everything was done. I was poked and prodded. I felt like prize meat. And I felt like I did not know how to advocate for what was happening in my body. And I felt unheard and I felt unlistened to. So one of the things that I want to know are, what are some tips? What are some ways that women like me can advocate for themselves to be heard? The other part of that question is, I know the topic today is they're not listening to us, but what happens when us isn't listening to us? Because that has also been an experience as well. What do we do when my doctor, who looks like me, still does not listen to me? How can I make myself heard and navigate through the trauma that I feel when I purposely planned to see a doctor who looked like me? I did it on purpose, and you still are not listening to me, and the trauma that comes from that.
Comments, questions, concerns?
I can go ahead and go because I feel like the journey for a Black woman, especially with finding the provider that's going to best care for us, feels like going through the forest and through the woods forever and ever. It can look like that. But I often try to humanize the experience and say, we go through the same thing with our hairdressers, we go through the same things with our nail technicians. And so that same due diligence that we would put into making sure that whoever's doing our hair is doing it right, we also have to have that same due diligence for our bodies as well. I think that's so important because, as you've mentioned, all skin folk ain't kin folk, because people are biases. It's not our color that makes us inherently biased. It's, our experiences, our perspectives, it's how we've been conditioned, it's how we've been raised. And I think it's really important to be able to find the people that will best take care of your needs. And what I may need and what I may have, enjoyed from a particular provider may be totally different from your experience. And I think there are companies like the Earth app. I don't know if you all are familiar, but it's Birth without the B. They do an incredible job with making sure that information isn't get kept, so that we know what are the conversations that you can expect to have with certain providers. What are some of the harms that have already been perpetuated in these types of environments, so that we can make sure we stay away from those environments. And then also leaning into the care that we want outside of the traditional Western practices as well. That has been life-changing for me in my experience, having a medical doctor where I know that on an annual basis, I have records of my, blood tests and everything like that. But where I'm getting my treatment, where I'm getting my recommendations, I get that outside of the traditional medical industrial complex. And that's because I want to be able to get to the root of issues. I want to be able to understand why PCOS is happening to me. I want to be able to understand why my fibroids are growing at the rate that they're growing. And I want to be able to understand for me what's going to help me have a normal menstrual cycle, what's going to help me have the relief that I need. And it's a personalized journey. It's not going to look the same for anybody, but it's going to require as much diligence as making sure that, that press and curl is laid. So that's been my experience with seeking and finding providers the best care for me and other Black women.
All right.
Right, child.
So, listen
This
to
is
the trick.
trick.
Sorry for those who are tuning in to the Hood Talks podcast on social media. That is why you should be in the building. We unfortunately got to go. But we're going to keep this conversation going in here. And that is why you should be in the building. But I do want to say our next conversation is happening May 25th. We will be talking about the intergenerational cycle of motherhood. Because you said something about that stuff. I was I know. That hit me, Lord. That's mother day coming. So that will be our next conversation. We'll be here at the Del Mar Divine. All right, y'all. So 2:00 Saturday, May 25th. Come in. You can go on Eventbrite, get your tickets, come up in the space, and you'll be in this conversation as well. Panel will be announced soon. Make sure you like this video. Make sure you share this, because this is a conversation that needs to be heard. And on that note, y'all, we out. Don't forget to subscribe to our YouTube page and also follow us on all our social media. And you can find all of that information at www.thehoodtalk.com.